Hi, welcome to the Nurse Preceptor channel on YouTube. My name's Hillary and I'm your Nurse Preceptor. Welcome to my home office. This is where I'm going to be recording some of the videos for this channel. So I'm going to talk to you about a topic that's near and dear to my heart today, and that is to have a emergency travel first aid kit for you and your family. And the reason that I started putting one of these together for my own family was because when my daughter was playing soccer, I noticed that a lot of times kids would trip and fall, and either they would skin their knee or get cut, or they'd hurt themselves, get a little bump or bruise. No one ever seemed to have any first aid materials nearby, so I started carrying a small first aid kit with me to the games and to the practices. And yeah, we had to break things out a few times, Band-Aids, triple antibiotic ointment, things like that. I a lot of times also carried one of those portable ice packs that you crush and activate, and those are very helpful as well. As you know, especially little kids, sometimes ice packs are the miracle drug. But in all seriousness, sometimes emergencies can come up, and it's very good to be able to be a first responder. And I believe personally that every one of us is capable of becoming a first responder. It's just a matter of knowing what to do and having the right equipment to do whatever you need to do. So I have put together a very short, concise list of things that you would want to consider having in a travel first aid kit for you and your family. I chose things that would tend to universally be good for things like bumps, bruises, scrapes, cuts, stings, sprains, strains, and even possibly breaks. And what this is not a video that's intended to recommend treatments for anything. I'm not trying to advise you about how to practice medicine on your family. I am rather trying to just give first aid advice and instruction so that you know what you need to have on hand to treat small things that come up. And even if it's something a little more serious like a broken bone or a bad sprain, sometimes being able to stabilize somebody who's out in the field while you're waiting on either help to arrive or while you are in transit to the hospital for further evaluation. It's good to be able to do that. So my list is pretty short. I will show you what I have for my own car. I have a nice nylon bag with a shoulder harness. It's easy to carry, it's water resistant, and it can hold a lot. I do want to mention one thing. If any of these items are items with an expiration date, you do from time to time want to keep an eye on the expiration date. And things like the alcohol pads and Band-Aids especially, if they're left in a hot car, it can possibly lose its effectiveness. And I've had alcohol pads completely dry up, like where they are dry as a bone when you go to take them out. So from time to time, you're going to need to rotate your stock and make sure things are still fresh, okay? And if you have any kind of emergency medicines in your kit, you're going to want to not leave those in hot cars. So first of all, I keep with me some scissors, and I put them down. They're there. So I just keep some scissors in there because it's helpful to cut bandages, and it's also very helpful if you ever need to remove a piece of clothing that's too tight, like if someone breaks an arm and they've got long sleeves. If it's one of those situations where they don't want to take their shirt off, or if they can't, you can always cut the shirt off if you need to. Second thing I have on here is a flashlight. And hang on one second. Flashlight's in the bag. And the reason I have flashlight on here is because, of course, if it's dark, it's going to be impossible to see what you're doing. But it also makes it where if someone has a cut, you can shine the light and sometimes see if there's debris in the cut or in the abrasion or scrape that someone might have. So it's a good thing to have. Water. So I recommend water. I usually use commercial bottled water for my emergency kit, but any kind of water will do, and that's to be able to flush away any debris from a wound or a cut or a scrape. I keep some glucose tablets on hand, or you can use candy, which I have on here as well. Glucose tablets you can purchase at any box store, and these are just for an absolute emergency. If someone is a known diabetic and their blood sugar starts to drop and they feel it coming on, you can offer something like this as directed on the package, just one, as long as they are conscious. You can do that. Band-Aids. I have several different sizes of Band-Aids, including some large Band-Aids, a whole bunch of small Band-Aids, and some butterfly bandages, which are just kind of stick-on sutures if someone has a pretty straight cut that looks clean otherwise. I also have antibiotic ointment, triple antibiotic ointment. It's pretty standard. If someone has open skin that's intact, after you've cleaned it, you can apply that and then put your cover over it. I keep alcohol pads on hand. These are great for insect bites, and it's also good for being able to disinfect around a wound, although I wouldn't recommend using alcohol directly on a wound. It is very, very painful, and it will sting like crazy. I keep an assortment of gauze pads on hand. This is just a pretty large one that can unfold, or you can kind of ball it up to put direct pressure if there's a wound that won't stop bleeding very quickly. I keep a waterproof barrier on hand. This is just a hooded poncho that you can unwrap and lay it out if you need to keep the area dry, or if you need to provide some kind of environmental cover for your patient, like if it's raining outside. Medical tape. I keep just some standard cloth medical tape, and I also keep some self-adhering medical wrap that kind of works as a tape if you've got an area that's around a limb, like around a hand, a finger, an arm, leg, etc. And you can do that without any adhesive, which is nice. I consider keeping some Benadryl on hand in case someone has an allergic reaction if they're stung. I also keep a splint, and this is an ankle splint. The way that the ankle splint would work is that if someone had an unstable ankle, and I can't really show you, but you would have them step into this like a stirrup and then wrap it around their ankle. And this just helps to stabilize an ankle joint, especially if you suspect that there might be a break. Again, don't use this unless you feel comfortable doing so and you've practiced at home. You can also use this to stabilize an arm, which is why I put this in here. Because if someone has a wrist that they suspect might be sprained or broken and you want to just stabilize it until they get to the hospital, you can put this over their wrist. Use the Velcro straps to gently keep this in place, and it will help keep the joint from moving. I keep an ACE wrap. These are good. These are very, very handy for a number of things, sprains and strains especially, but you can also use it to wrap an extremity that's starting to swell. It provides gentle compression. Just don't apply it too tightly. You do not, excuse me, you don't want to cut off the blood supply. I also have some basic personal protective equipment, or PPE, in my bag. Of course, hand sanitizer. I have that with me pretty much all the time. And I just wanted to show you this cute little, it's a doctor hand sanitizer vest. It goes with, I guess it's a doctor. We'll just say it's a nurse for the sake of my channel. But I thought it was kind of cute. So anyway, we've got hand sanitizer. You would want to use hand sanitizer before you touch someone, especially if they have an open wound of any sort. Gloves. Please don't touch any broken skin or any blood without having some gloves on. Even if, like, let's say someone has a nosebleed, have them hold pressure on themselves if you don't have gloves available. Okay, even though they're kids, you do not want to be touching people's blood. It's not only gross, but it's a great transmission of disease. Masks. I keep masks around because I'm a nurse and I like to have masks around. But I guess these would be helpful if someone was, spewing blood all over the place. You could put it over your face and at least keep your face from getting splashed or, getting it in your mouth or anything. I keep them around just because. And then I've got a disposal bag. So this would be like to clean up any of the debris. Afterward, you can throw it all in here, tie it off and throw it in trash. And as long as it's not an enormous amount of blood or bodily secretions, it's fine to do that. All right, so anyway, that's what I have in my emergency bag. One other thing that I keep with me that I would not necessarily recommend is a tourniquet. And I have a very simple tourniquet. It came in an IV kit a long time ago. It's simple latex. And this is in the extremely rare event that you are the first responder to someone who is like grossly hemorrhaging, like someone who has had an injury that has taken part of their foot off or their leg or anything like that. If you're in a real situation where they are starting to bleed out and they're starting to get a little shocky and you need to stop the bleeding, you can apply this. I would only do so once you have had training to do so. And since I am a certified emergency nurse, I have had to do that before. And it's a little scary. It's not really something that's recommended unless it is an absolute emergency. So if you have any questions or comments, please let me know in the comment section. And otherwise, like, share, or subscribe, and I will include some more content, and I'm going to be covering a lot of things as far as basic first aid. All right? Thanks a bunch.